Good afternoon, everyone. Today I'm going to discuss to you something that I'm very passionate about when it comes to EMS. You may wonder why I'm sitting here giving my speech in a t-shirt, and it's going to be for demonstration purposes here very soon. But the part of EMS that I really enjoy discussing is stop the bleed. You guys are wondering why. Well, bleeding control is one of the easiest topics that we teach throughout EMS, but it's one that's typically missed, not done correctly, or forgotten about. Well, today in particular, what I want to discuss is the application of a tourniquet. The tourniquet that we're going to be using today is actually a Cat 7 tourniquet. All right, and I'm wearing a short sleeve t-shirt as well as shorts just so I can show you the application process and how it works. So the first part we need to know is to understand, why do we need to use a tourniquet? Well, in this time and age, and it's sad to say, but some of the things that we're going in through is having active shooter events, the rioting, things that are going on, and active bleeding is something that needs to be controlled sometimes at these events, and it's something that I pray to God you'll never use, but hopefully I can teach you something today that you'll be able to use later on down the road. So, a couple things we need to know about why we need to apply a tourniquet. Well, the reason why we apply tourniquets in particular is for arterial bleeding that is very difficult to control. Is it always going to be done for arterial bleeding? Not necessarily. You could have venous bleeding as well, which is slow, typically. Sometimes it can't be controlled, and this might be your only resort. Okay, there's many different style tourniquets out there. I'm not demonstrating which one I prefer. This is the one that we actually carry on our apparatus. I've been fortunate over the past few days. I've actually had to use this on 2 patients now, so had a little bit of experience with it. So, first and foremost, we use the tourniquet to stop the bleeding. All right. Now we need to know how or when or where we need to put this tourniquet on a patient. So 2 spots that I've marked on my body, one right here on the bicep. All right, that X is going to simulate our bleed. I also have another one right here on my upper thigh. Okay. I'm going to show you where and how I apply these tourniquets. The good part about the Cat 7 tourniquet is that it kind of has a marker of where you need to place it. At the top of our tourniquet is a red tab. This red tab is to always face towards the heart. Okay, so if I'm applying it on the left side, I'm going to have my tourniquet positioned like so. If I have it over on my right side, I'm going to be positioning it this way. This is just so it's easy access for us. Okay, next, depending on which version or which videos you watch or who your instructor is, tells you on where you should always apply a tourniquet. Being prior military, things that I've learned is I always put them high and tight. So if it's on my upper extremity, I'm going to put it right up here towards the shoulder as best as I can, as high as I possibly can get it. A couple reasons for this. Number 1, it's up, out of the way. Number 2 is going to be if I have to apply a second tourniquet to stop the bleeding, I still have room to work to be able to do so. Okay. So we're going to use my left arm as it has a controlled bleed. First thing we need to know, wear gloves. This is proper PPE, personal protective equipment, body substance isolation. I'm doing this as a single person technique, preferably you as a patient. You don't want to be the one applying your own tourniquet, but if you need to, I'm showing you how to do it. Take the tourniquet, once again, we need the red towards the heart. Going to place up, high, and tight. Take your band, pull it until it's tight. This piece of the tourniquet is called a windlass. You always want that windlass always near you so you'll be able to access it. Okay? You'll apply it tight and you'll wrap your Velcro all the way around. You want to always make sure that this is at least 2 to 3 inches above the injury. You're going to take this windlass and you're going to begin to twist. You're going to twist until the bleeding stops. Okay? So we place the windlass on. I see that my bleeding has stopped. I'm going to lock it in place up here on the top in the windlass clip. Next part is this last piece right here, which is the strap that covers over. It prevents it from popping loose. But if you notice, I'm going to get closer to the camera here, it shows time. Anytime we apply a tourniquet, we want to place the time that that tourniquet was applied. So what we like to have is a marker. If you don't have enough room to write the time there, if it gets covered in blood, another thing you do is put it right up here on their forehead. Why? It'll let the doctors in the emergency room know that you have applied a tourniquet. What we do is we put a T and the time next to it. Okay, so the first demonstration was for the upper arm. Next one I'm going to show you is a leg. We're going to undo our tourniquet. By the way, for future note, if you ever demonstrate or practice with a tourniquet and you twist this windlass tight, that tourniquet's considered no good anymore. This was one that was already used for training purposes, so that's why I'm still using this today. My regular tourniquets that I carry on my own self person are still properly wrapped up, ready to go at a moment's notice. Next one I'm going to describe is going up here on the upper leg. We're going to say that it's about mid-thigh, all right, my injury. I prefer, or at least in EMS, we remove clothes. We cut the clothes off so that way there's no disturbances and we actually have visibility of what we're trying to work on. All right. If in a moment's notice it's a gunshot wound or something, you just need to stop that bleeding, you can leave the pants in place, but remove keys, remove wallet, anything that might interfere with where this tourniquet is, get it out of the way. Take that tourniquet. I'm going to just lift my leg for right now. There is nothing that says you can't undo the tourniquet. Place it up here towards the upper groin. Red tab through, pull it tight. Remember the windlass. You want the windlass so you can see it. You'll apply, and then begin to twist until that bleeding has stopped. Okay? Lock it in place once again, wrap over to secure it, and notate your time. Things to check after you've applied a tourniquet. Number one, make sure the bleeding's controlled and make sure it's stopped. At this time, you can apply your gauze, you can wrap it up with some bandaging if need be, however you want to do it. Next thing you want to check is a pulse. All right, so if it's for an upper extremity, we're going to check this pulse right here, which is known as our radial. Okay? If it's on the leg, we're going to check pedal pulses, if we're able to, which is right located at the top of your foot. We want to make sure that the pulses are gone. All right? Or if you're still feeling it and you still see bleeding, that means you probably need to tighten the tourniquet a little bit more. Hopefully this has been informative. It'll teach you something. I pray to God you never have to use it, but in a time of need, if you have a tourniquet available, you'll know how to use it on someone else or possibly yourself. Take care, everyone. Y'all have a wonderful day.